Hi everyone, I'm Dr. Samir Undavia, a facial plastic and reconstructive surgeon in Prince, New Jersey, and today I wanted to speak to you about who the best candidates are for repair of their septal perforations. Well, number one, symptomatic patients. So it doesn't make sense to fix something that doesn't bother you. There is some worry that the perforation might enlarge or that you might have more nosebleeds, but if your perforation doesn't bother you and we're able to treat it conservatively with hydration and routine inspections, then it's reasonable to leave it alone. Number two, anterior septal perforations, or perforations that are towards the nasal tip, are most amenable to treatment. And that's for two reasons. Number one, the more anterior the perforation, the more likely it is to be symptomatic. And number two, it's a matter of access. The more posterior or further back a perforation is, the harder it is to get to and fix. Posterior perforations are also more likely to be silent and asymptomatic. So number three, smaller perforations. The smaller the hole is, the easier it is to close. Large perforations sometimes need to be closed in a staged fashion simply because there isn't enough material to bridge the gap. The smaller the perforation, the easier it is to close on the first try. And number four, there should be no other confounding medical problems that increase the likelihood for a recurrence once the perforation is fixed. Things like severe allergies, connective tissue diseases can keep from making the perforation closure intact very difficult. So I hope this was informative. If you have any questions about septal perforation or have a perforation that you want evaluated, call us at 609-403-8840. You can also email me direct questions and pictures if you have them to info@drundavia.com. Since I have patients come to me from all over the United States, it's helpful to have medical records and endoscopic pictures sent directly to my email. That way, if there's an issue that needs to be addressed prior to making the trip out to New Jersey, we can take care of that beforehand and save you some time and hassle. So thanks for tuning in. Remember, trust your face to a specialist, and until next time, I'm Dr. Samir Undavia.